Madam Speaker and members, I've learned a lot over the last few weeks and months of this legislative session, especially in this area of health care. Like Representative Baird, I'm not an expert on this, but I learned a lot. Went into this session not fully understanding what many of the acronyms mean in these areas. GAMC. Thought it was a car for a while, quite honestly, members. Come to find out it's general assistance medical care. That still doesn't mean anything to me. So I had the opportunity to have the Commissioner of Human Services explain to me what that is. It's basic health care. Those are his words, basic health care. And I asked him, basic health care for who? He said for Minnesotans who live on less than $8,000 per year. $8,000 per year on average. Basic health care for those Minnesotans. He called them the poorest of the poor and the sickest of the sick. Representative Hamilton and others, we can talk about priorities. We can read off lists of things our government will fund and will not fund. None of that matters on this vote. This vote says, I don't care about a hockey arena or anything else. This vote says, if you vote yes, my priority is for basic health care. So we can cut through all of the other issues. Members, after we vote on this, and I hope we vote on making sure that the poorest of the poor and the sickest of the sick have basic health care, after I hope we vote yes to maintain these thousands of jobs all over Minnesota, we can get back to debating other priorities, trading barbs back and forth. But this is a very simple vote, members. For those who stood up and said we should have made this a priority, we can with this vote. Madam Speaker and members, having grown up and living in rural Minnesota, in a town of 5,000 people, I'm the last of my generation. The folks that grew up in my town are the last of my generation who actually were born in the hospital in Chisholm, because it's not there anymore. There's only one hospital left up there. It's a hospital in Hibbing, which you'll see over a $1 million cut if we don't change our priority today. And if that hospital survives, and hopefully the hospital in Virginia survives, next place you can go is Duluth. Beyond that, some folks go to the Twin Cities or Rochester. Not those Minnesotans, though, that are living on $8,000 a year. They can't go to Mayo. These are our military veterans who are homeless. We talk about tough choices today. We all have tough choices. Well, we all slept with a roof over our head last night in this room. We all are very comfortable in the clothes on our back today, in a very comfortable room. And we're talking about tough choices. The tough choices that are being made by the people that would be cut off of their health care by this, the tough choices they are making or where to sleep tonight, but where they're going to get their next meal, about how much pain is in that toothache that's decaying, and how long can they hold off going to the emergency room. It's about deciding for many of those Minnesotans whether they pay to turn on their electricity this month or their water. We don't have tough choices here. Certainly not as tough as the Minnesotans we're talking about today. I'm not going to debate Scripture or other political issues with you. I'm just going to tell you, growing up in Minnesota, what my values and where I get my values from. I get them from my faith, but I also get them from my family. My grandmother and grandfather owned a grocery store in Chisholm. And when somebody came to their door who didn't have enough money but was hungry, they were fed. And we can all try to do that individually. We've all been trying to do that individually for thousands of years. But we, the people, have also decided to have a safety net, to do it collectively. This is a part of that safety net, members. So let's make it a priority over hockey arenas. Let's make this a priority over everything else or anything else. I don't think there's any excuse today to not vote to take care of the least among us. Let's make basic health care for Minnesotans. Let's make those jobs available in every community so hospitals aren't closing down, so people aren't losing their jobs. Let's make basic health care for those Minnesotans living with mental illness, those veterans. Let's vote for them today and make them a priority. Madam Speaker, members, please vote yes.
Madam Speaker, you know, I was going to get up and talk about 3 examples of good friends. Because basic health care was not available, they're no longer with us. And so I decided I wasn't going to say anything because I wasn't sure I could hold it together. So I'm not going to talk about those close friends other than to say, folks, we're talking about life and death here. Truly. And I know it firsthand. But instead, I want to talk to you, and maybe I can do that a little bit clearly if my eyes clear up and I can look at my notes here. I've been in this body for 37 years. And believe me, this is the toughest afternoon I've had. And today, I'm going to be casting probably the most important vote that I have done in my political career. Because I care about people, and I know what needs to be done. And you know, I ask you members to rise above your political party, rise above politics, and do here this afternoon the right thing. Hubert Humphrey was quoted twice, and I happened to mention this quote to the speaker earlier today. But you know, a man without tears is a man without heart, and so I guess I'm up here with tears today. But please, rise above politics, do the right thing, and provide the votes necessary to keep this program funded and in place. Thank you.